and good evening, everyone. Welcome to the living room. Thank you all for being here, everyone in the room, and those of you who are joining us online. We're very excited tonight to have our one and only, because we are so busy this year, Patient Roundtable, which is one of my most favorite living rooms, where we get to share hope between one another. Normally we have key opinion leaders, different stakeholders, people coming in to talk about different aspects of the disease, but tonight it's all about you, and it's all about your voice and who you are as a person with cancer and who you are as a person without cancer, and what kind of support that we can bring to one another. So I'm really, really excited to have everyone here tonight. As usual, we will start with our Around the Room. Those of you, it is not mandatory that you speak on camera, but we would love it if you did. There are, per Michelle, a ton of people online who want to hear from you. Hopefully some people online will want to introduce themselves as well. Tell us who you are, where you're signing in from, so that we can learn from one another and support one another. I think it's one of the most important sort of aspects of this is feeling like you're not alone. I hear all too often, and I know Michelle does, and my mom does too, that there's a certain amount of sort of loneliness that comes with lung cancer. So there's some new people in the room, maybe some new people online. For those of you who don't know me, my name is Danielle Hicks, and my role here at the foundation is to oversee patient programs and services. So anything that has to do with patient touch, patient support, patient education is my area of responsibility, of course, along with an amazing team and group of people who are helping us to get it all done. So with that, I think we're going to start with the Around the Room. Oh, and more importantly, I'm her daughter, her oldest daughter, as my sister always likes to say. The youngest one is in the room tonight. I am the oldest. But I'd like you to maybe introduce yourself, especially because there's new folks. Say who you are, and talk a little bit about your own personal cancer journey.
Okay. I'm Bonnie. I'm Danielle and Andrea's mother. And Jared's mother, he's not here. But I'm a 14-year lung cancer survivor.
I'll correct her if she says something wrong, by the way.
Yeah.
Just so you guys all know. I will make sure. Yeah.
But, you know, I started this foundation a long time ago, really because of the injustice in the research funding for lung cancer that I just, you know, discovered while I was going through treatment myself. And I made a promise to myself while I was in the Barca Lounger getting chemotherapy, because there were no targeted drugs at the time. Tarceva was in clinical trial. And I made a promise that if I made it through the knothole, I would do something about that. And we've been 14 years pressing ourselves to get something done about that. I'd like to introduce a special, you're all special, everybody in this room is special, mostly the patients, but we have a visitor from Washington, D.C. today, and her name is Lori Fenton, and she's the CEO of the Lung Cancer Alliance.
Hi, Lori.
We've been doing a lot of things.
No pressure.
Yeah, we've been doing a lot of things collaborating with their group, and you know, we're getting a lot of work done and having a lot of fun, and we're doing a collaborative 5K in Philadelphia this year as well. So happy to have you here, Lori. And on that note, well.
We are, but before we do that, I just want to, so I was in, Michelle and I and Jennifer and Nicole, who some of you may have met at the last living room. She's fairly new to the foundation. We're in Chicago. It feels like yesterday, but it was
last week.
Thursday, I think. We had our what we call from here, our remote living room, but we actually had our Chicago living room. And it was fantastic. And one of the things, because I don't have my mom there as sort of my what would you call us? Moderator, but that sounds so like...
Well, just your co-person.
Anyway, just as my co-person, I felt the need to kind of tell her story for her, and from the perspective of the daughter, right, and the caregiver, and I know there's caregivers in the room, and you have no idea how important you are to the people that you are walking through this with. And it was just interesting to see the reaction from some of the folks who didn't know us, and sort of my perspective on your diagnosis and your journey, and then starting the foundation and what we've been able to accomplish. And I am obviously incredibly proud of of this woman right here, first and foremost, but what we have been able to accomplish in such a short amount of time, because although you were diagnosed 14 years ago, the foundation is 11 and change
12
years
years.
old. Oh,
Yeah.
yeah,
12
yeah, it was just
this
12,
year.
yeah. And we've been able to raise over, $30 million and 80 plus, percent of which goes right out the door to support programs like this and the all too important research in order to keep the ball rolling. So just a little pat on your back for what you've been able to do.
Well, it was my passion at the time was to raise money for research and give it to my UCSF team. And actually, these people in these pictures behind me that was my radiation oncologist, Lisa Buhar. Fred Marcus was my oncologist, and Melissa Lim is still my pulmonologist. And my thoracic surgeon was David Jablons at UCSF.
But that is actually her x-ray as well.
And that is my x-ray, my tumor. My tumor was actually on my heart. And I was told by many people there was nothing they could do, and this could maybe start the conversation tonight. And that obviously wasn't what I wanted to hear. So I found my way inadvertently up to UCSF and sitting down with this crazy thoracic surgeon. And he said, Bonnie, he said, I know you've already heard from several people that there's nothing you can do because my tumor was invading my heart and it was just inoperable, they said. So he said, what do you want us to do? And I said, if I'm going to die from this disease, I don't want it to be because I did nothing. So I want you and your multidisciplinary team to throw everything you have at me. And I'll take it. I won't complain. I won't say a word. Let's just see if we can do something. So he put together the team. He took it to tumor board. He talked to a bunch of people. They came back and said, we're going to put you on a rigorous chemotherapy. They put me on, some of the folks in the room tonight from a pharmaceutical company will know how toxic a double platinum is. But they put me on that ×3 for my first dose.
That's radiation.
And then radiation Monday through Friday. So I had chemotherapy every Friday, and Monday through Friday I had radiation. And I was lucky. The goal was to move the tumor enough away from the heart to go in and try to get it out of there. And after about 14 hours and 3 surgeons, they were able to get it out. So my point is in telling this story is that, you're in charge of your own treatment. Yeah. We like to help you, and all we can do is help and, advise you and tell you what to do. But you're in charge. And when you're having a conversation with your physician, and don't ever be talking to anybody that doesn't have a multidisciplinary team like this, and tumor boards and genomic profiling and the full set of options for you. Don't let anybody tell you that you don't need a second opinion or any of those things. If you don't like what you hear, go get a second opinion, because I got 3 and 4. And I can guarantee you I wouldn't be sitting here today if I listened to the first couple of people. So maybe that's a good way to start.
It's a great
tonight.
segue. And those of you who are veterans here at the living room and or online who have been watching for a while have been hearing us talk for 12, 18 months now about this shared decision making, and it's what you're talking about, and that conversation with your physician, and what are your goals of care, and what might that look like based on the options given you. So. So I think that's going to be a really important part of tonight's discussion. I think we should do the around the room, though.
Yeah, absolutely.
Yeah. So I think last time we went left, plus I don't want to put the newbie on the spot to go first, so I think this time we'll go right and start there. Please don't forget to grab your mic so that the folks watching from online can hear what you're saying.
And maybe after you give everybody a little history on your story, you'll tell us what's keeping you up at night. If everybody would add that to your story tonight, that'll help us get to a really good living room and where we want to go. What's keeping you up at night? What are you worried about? What are you thinking about that's keeping you from going to sleep? Okay, all that rattling around in your, okay.
Hi, good evening, everyone. My name is Renlong Zhou. I've been attending this kind of event for 3.5 years now. I still remember very clearly when I first diagnosed the lung cancer back in 2014, November 2014. And I also been introduced to join the activity here. So the very first time when I came here, I shared my story. I was especially inspired by Bonnie and her story, and it seems like even worse than mine. And there are a couple of other patients and friends and told me that you're going to be fine. At that moment, I never thought that I'm going to be fine. So, by the way, I was diagnosed like stage 3 squamous cell on my left lung. So I only think of negatively and be prepared for like not a very long term anymore. So mentally, it's pretty sad, very depressed. But again, like Barney said, you don't want to just live as is without doing everything you can. You don't want to regret for not doing enough from your side. So me and my wife, we never thought that this is going to be it. We did everything we can in terms of finding the resource and look for the treatment and a second opinion, everything we could possibly do. From the first X-ray, and it shows the big mass, until the first infusion of my chemo, it only took me like 10 days. That's pretty quick, and even the oncologist said, you seriously want to fight this? I said yes. I don't want to just to go out do anything, even though I don't feel the pain as of yet, but I want to treat this as my priority. I don't want to delay a second. So he very much cooperated and worked with me. And 10 days later, I start my first dose of infusion. And after 3 rounds, and luckily my tumor got shrinked quite a bit, 40% shrink. And after that, my surgeon started to say, okay, now I can take you, we can do a surgery. So in the February time frame, I think, I did the surgery. And although it's a pretty hard one, and I had a left lung pneumonectomy, so I lost my whole left lung. But the result was really good. I didn't need additional chemo. There's no need for radiation. And then I just have to follow through, and every 6 months to do a surveillance check. So my last CT scan was done last month, and it still shows no sign of disease. So that's been 3 months, 3 years and 2 months. So I was really lucky, and I want to echo what Barney said. Even the doctor cannot say what is your chance, what is your percentage. If you look at the whatever document, all the statistics show nothing apply to you as an individual. To you, it's all about you. And whether it's 3%, whether it's 16%, whether it's 70%, none of this number apply to you as an individual. When back at that time, when I look at my number, it's less than 4%. The survival rate, like over a year. But look at that, and I already 3 years and more. So I'm still kind of looking good, knock on the wood. So I want to encourage everyone, and no matter what stage you're in, and you do everything you can, you are still 100%, and you're going to be fine. Just be hopeful for that. Okay, so I don't want to share with that for now, and hopefully not taking too much time.
Anything keeping you up at night? Anything keeping you up at night?
Oh, yes. At this moment, I don't feel anything keep me up, worry about my own health. I'm at the stage, I still have 2 seniors, parents with me. I need to support them. I have a younger ones and a junior high school, and she is actively applying, getting to a college. So that's probably something occupying me at the moment. And my son is attending college in Harvard, and he's a senior, and in a year he will be graduated. I was looking forward to what his first job is going to look like. So that's probably...
There you go. Because
yeah.
he's going to be taking care of you about 30 years from now.
Oh, yeah. Okay.
That's how that
Yeah.
works.
So life is bright and it's great, and even though there's still some kind of a cloud there, but I look on the bright side. So life is still good.
Great.
Thank you.
Thank you. Yeah,
I'm next.
You're next.
Come on, Ron.
So last month before, a lot's happened in the last month.
So if you recall, sorry not to interrupt you, Ron, but Ron was, after the last living room, was heading off to the Hope Summit.
Correct.
And we told him he must go and come back and report on how everything went and all the people you saw and how positive it all was. So I don't just want you to introduce who you are and why you're here, but I would love it if you'd also give us some
Yeah.
good news from the East.
From the left coast.
Yes.
From the left coast.
Wait, we're the left coast. We're the right.
From the right coast.
Depends on where you're sitting.
Yeah.
So I'm Ron Fong. I'm a caregiver advocate right now for lung cancer. My wife Joan had lung cancer. She was not a smoker, but she had lung cancer because if you have lungs, you can get lung cancer. And she had tested as a mutant. So she's not an X-Man, but she's a mutant. And that means she could take a targeted therapy. And talking to your point about statistics, the big statistic that matters is you, the N of one. You're a data set of one that makes the difference. And so, but nonetheless, if you happen to read Dr. Google on the internet, you can't believe everything you read on the internet. That's what Abe Lincoln told me. So we went through 15 lines of treatment, 3 phase 1 clinical trials, and 45 months, far surpassing what you read on the internet, because the internet statistics that you read about survival rates are old. They're based on statistics that come out for 5-year statistics that come out in July, August every year. And those numbers that you read online today are all before there were targeted therapies that came out 5 years ago.
Right.
So this year, when the statistics come out, they should show a marked increase in providing the hope that we talked about on this wall. So there we are. So it was a very busy, before I forget, I do want to say today is May 15th, which means I get to say to my friends, Ramadan Mubarak, because today is first day of Ramadan.
Okay.
So you want me to, it's a really long story. I can tell you lots of stories.
No,
but,
but make it short.
Not that short.
I met a lot of people there. One of the things we did was we did a red hat ceremony. These people, these 2 brothers in Christ that I met, they met Joan in Michigan at a conference, lung cancer conference. And one of them was bold enough to say, I really like your smile, Joan, and I like your spirit and your attitude, and I want to remember you always. When you die, can I have your red hat? Now, most of us would say, what in the world, blank, are you talking about? Joan just took it with a big grin and said, of course you can have my red hat to remember me by, but I intend to hold on to this hat for a long time. Well, it's been a while, and then they called me up. One of them called me up and said, you know, the guy who asked that red hat, and I never heard the story before, he goes, he's going to be in Washington, D.C. for this rally. Would you like to hand off the hat then? And so I said, sure, because I want Joan to be remembered. Everybody wants to be remembered by something. She had this red hat. So we came from Florida, from Michigan, and from California to hand off this red hat. Now, in my mind, when you have a red hat, you're part of the Red Hat Society and you need to wear a purple dress. But we're guys, so Adario here had a purple golf shirt. It was the most purple shirt I've seen in a long time. So I handed it off to Jim and we did that. So that was a Red Hat ceremony. We had a rally with a 433 a day rally. because 433 people a day die of lung cancer. And as a result of that, there were about 200 people in front of Capitol Hill sharing about it, and some of them had shirts that looked like this.
Yep.
Is that a shiny shirt or what?
And this was a beautiful thing because it was totally patient-driven. It was patients from all over the United States and other places even. And, they did it on their own dime. They did it on their own, and they went to D.C. It just so happened that it collaborated with the Longevity Summit, which was great.
And so this other shirt is that, which is a dry fit shirt, so it's more comfortable, no glitter. It says that lung cancer is a national emergency, and we need to support that. So some of us, after this rally in front of Capitol Hill, about 200 of us, we went up to our Congress people and asked them support funding more research for lung cancer and making an effort for early detection and doing good things. Ro Khanna, who's a congressman in this area, he is one of the co-sponsors of H.R. 4897, which is the Woman in Lung Cancer Research Bill. So if you see your congressman, say thank you. If you see your congressman, say, why haven't you supported this yet?
Right.
So that's what we did. The Hope Summit was immediately thereafter.
You know what Ron's doing right now? He's lobbying for another T-shirt. There's just no doubt in my mind.
Every year they do a Hope Summit. There were 400 people there this year.
That's awesome.
And they were lung cancer patients, lung cancer survivors, lung cancer co-survivors is what they call caregivers, and people from industry and government as well. So we had people from government, from NIH come and talk, and other researchers in advance. And they had roundtables where you had little tables and you sat down and you did 10 minutes with an expert. They had inspirational talks, Chris Draft talk, Adam Klein from Survivors talk, Survivor? Yeah, whatever that show is, and a bunch of other folks. And it was just really great to hear about, there are people who are lasting a very long time fighting this battle. And so it was good. And the best thing about the rally was we got to read names and put flags on the ground in remembering of those who went on before us. And so I got to read Joan's name, as well as Molly Goman and some others. So that was my short talk.
Thanks, Ron.
Oh, and I have cake.
Oh, cake is
yes.
good.
Sally and I brought cake today.
You
Sally
should
and Ron bringing
see
cake
it.
is awesome.
And Ron, I just want to say I loved the picture of Jim in the hat. And I'm pretty sure I owe Jim a word on Words with Friends because he's my Words with Friends buddy.
Yeah,
So,
mine too.
yeah.
Mine too. Yeah.
Yeah.
Yeah. Thanks, Ron.
How
Always.
do you follow that?
Yeah.
I don't have a wardrobe to show.
Your cute shoes, though.
Yeah. Yeah, you have cute shoes. You have cute
Yes.
shoes. Right. We don't do shoes.
Anyway, I'm Sally, and I was proactive, and I was at very high risk for getting lung cancer. And I was told about a study, the International Early Lung Cancer Assessment Program. And first I thought, I don't want to know whether I'm going to get lung cancer. But then I thought, my mother had it, her brother had it, my paternal grandfather had it, and actually my aunt by marriage, but that's not a bloodline. And I just figured my mother was very lucky. She was found first by accident in 1975. She thought she'd broken a rib, which she had, and in an x-ray they found the tumor. And she'd had an x-ray just 3 months before, a routine one, and it didn't show up. So hers obviously was found early. Came back 2.5 years later on the other side. They said it was a new primary. And then she lived 20 some odd years before the third one came in her mid-80s, which eventually caused her demise. So I thought, if I can be lucky like that, I need to know if I'm going to get it. So I entered the study, and you had to qualify for it, and I did because of family members and that I'd previously been a smoker. And I hate to say that part because of the stigma of that, but that was one of the requirements. And So they found nodules in all my lungs, which of course panicked me. And I was reassured by the cancer center at Peninsula, and which was where the study was being done. And I was reassured by my internist and everything that these were just little nodules and that I'd be watched. And 5 years later, one of them grew. And because of this study, it was found early. I had surgery. I had my lower right lobe removed, and knock on wood, it's 9 years. And I was told there was great likelihood it could return, but knock on wood, it has not thus far. And they still watch me because of the other nodules. But at this point, nothing has to be done. So I feel very fortunate, and I'm really a big believer in being proactive and in if you are at risk for lung cancer, or think you might be, that you do something about it, because the earlier it can be found, the better off you are.
So I just have a couple comments before we move on. One, thank you for self-identifying as a former smoker, because I think it's really important. We hear all too often, I was diagnosed with lung cancer and I never smoke. But what we don't hear is people who are brave enough to come up and say that they did, that they made a mistake, that they wish they could change, they can't, but they're people too. And to really put a face to this disease. And Ron said it prior to you, you don't have to smoke to get lung cancer, right? But we need more people just being people saying, hey,
And
right?
also that people realize that just because you quit smoking doesn't mean you're not going to get lung
Right.
cancer. I had quit smoking 15 years before I entered
Yeah.
this study.
Yeah.
And you know, I cite this published article in the New England Journal of Medicine all the time. It says that the biggest cause of the biggest tobacco-related disease is heart, and then second vascular, and then 31 cancers, not just lung. And somewhere along the way, lung cancer got singled out as the only cancer related to smoking. So my joy will be the day that a patient doesn't have to feel like they're at Alcoholics Anonymous and they have to stand up there and say, I was a smoker or I was a non-smoker. We don't care. We just want to keep you all alive and thriving. So hopefully the day will come that people don't have to identify themselves.
Well, the reason I identify it is because that was part of qualifying for being in this
And that's,
study.
you know what, good for you.
Yeah.
But I think it's important. So the second thing I wanted to just comment on is Sally being an early detection win, and it was before the National Lung Cancer Screening Trial and before screening was approved in this high-risk population of patients. It was a study that you were proactive about, and I think it's important to recognize that one of the potential silver linings in being diagnosed with lung cancer is an opportunity to talk about screening. When you're talking to someone about having been diagnosed, it's an opportunity to talk about how important it is for people to be screened who might be at high risk. And less than 4% of the people who actually qualify for screening are getting screened right now. And to Sally's point, if we could find these cancers earlier, the numbers that 5 years behind or not, they would change, and they would change dramatically. So I think really recognizing an opportunity during this conversation about your personal journey is a conversation with somebody who has not been diagnosed to kind of educate them on the screening. So those are just two things I wanted to point out. So thanks, Sally. Sorry to interrupt. We can go on now.
I'm Ina, and I was diagnosed in December 2014, an accidental finding. I never smoked, have to say it. I mean,
Okay.
I have to say it because everybody that didn't know me and, knew that I never smoked asked that question.
They
right?
still asked you.
It's like everybody asks you.
Yeah.
But to your point about the early diagnosis and screening, I went in for something totally unrelated, which was fine, and they did a CAT scan, which was a big deal, and picked up the lobes of my lung for an abdominal CAT scan, so you have to wonder about that. However, it showed a fairly large nodule in my left upper lobe, and everyone thought for sure it was cancer. And the pulmonologist who first told me, showed me my scan next to a textbook scan, and you really couldn't tell the difference. I mean, the tumor was like a hard-boiled egg-sized tumor. I had mycoplasmosis pneumonia, which is a crazy kind of pneumonia, like 18 years before, and it laid down scar tissue. And the scar tissue, actually, it was a scar tissue carcinoma, which is very unusual. So we went around. We did go to UCSF. We did get second opinions, and even third. And I actually was told, and I think this is also an important thing, while I think it's really important to go to a major medical center, I was told by a full professor of pulmonary medicine at UCSF, you don't need to come here for what you have. Well, no, and I think he was right.
Okay.
I really do, because he said, this is a basic, we can go in and get, go find the best cardiothoracic surgeon you can find in your local hospital that you think is good. And why do you have to put your family through coming to UC? His opinion was I didn't need the hassle of UCSF or Stanford, which I probably wouldn't have gone to. But anyway, simply go to a place where you're comfortable and your family can be comfortable, because it wasn't that complicated a surgery. It was a real straightforward, awful, awful. And I had to have two. But basically, it was an interesting, and I know we're talking, I think if I have a recurrence, and I do have also nodules in the right side, I have about 1 2/3 of my left lung gone, so I have a little bit of left lung. But I think that if I, have to have treatment, I'll definitely go back to UCSF.
Yeah. And I would just like to say two things. One, you don't have to go to an academic center.
Right.
But you do need to go to a center that is known for excellence in lung cancer. And I really kind of I'm a bit taken aback that a physician would say, you don't really need me, just go to anybody. And they
Well,
can
he didn't
mop
say
this out.
he didn't
It's
say
like,
anybody.
well,
He didn't say anybody. He was pretty specific
Okay.
about the quality of surgeon that I needed to look
Okay,
for,
okay.
and where I needed to go. Right.
Did this person help you get that appointment? and
Well,
set it
I
up for you?
already knew who I
Okay.
wanted to go to, or so I
Okay.
thought I did, and he
Okay.
confirmed that was a good choice.
Okay.
So
okay.
I guess, it was a little bit different. I know I've been coming here for
Okay.
almost 2 years, and I don't
Yeah.
think I ever told that part.
No, no,
There's always more,
Yeah.
There's always more to
And
this.
I'm not picking on you, but
No,
there's
no,
people
it's fine.
online and whatever they're going to just go to anybody. No,
No,
you want to make
no.
sure you go to people that are educated and know what
Absolutely.
you're doing. Yeah.
And of course, for an oncologist right now, again, because I don't need treatment
Right.
at the moment, and hopefully
Yeah.
I won't, but who
Yeah.
knows?
Right.
I have a pretty general oncologist, and I love her. But if if something pops up and I need to have it treated,
Yeah.
believe me, I'm going.
Okay, okay, okay,
Yeah.
I
okay,
know.
okay,
I think that's
okay.
a really good
Yeah,
point, because we hear all the time from people around the country. It's much more convenient to be treated as close to home as possible, right? So that your family can come if you need to, you can get support and that sort of thing. But I think when something changes,
Right.
That's the time to think, okay, do I need to now go get a second opinion from a key opinion leader in more of an academic setting, and then have a plan and then come back to my community setting and have my treatments there.
Right.
So, yeah.
Which is also why, so many cancer centers are popping up all around the country.
Right, and there are community centers that are actually academic-like care. We just
Right.
have to make sure
Yeah.
those are the ones you get to.
And make sure that you're asking the right questions,
Yeah,
right? And
right.
you guys have heard me say time and time again, particularly in the more rural community settings, that between solid tumor and blood cancers, there's 100+ different types, and to expect that any one human being could know everything there is to know about whatever walks through their door is unfair and unrealistic.
Yeah.
So it's very important that you do the research to find out who the experts are as close to you as possible,
Right.
so that
Exactly.
you can get that opinion.
Right.
Yeah.
Oh, right. Okay, Sally, thank you. She reminded me. So after I had the surgery and they did a wedge resection, so minor by comparison, you still need a chest tube.
Yeah.
And as I've said, I'm an old nurse from like 50 years ago.
Yeah.
And everything has changed in medicine, but not chest tubes.
No, and that's the worst part of the whole thing.
They're horrible.
Right.
They're horrible, and they
Right.
hurt like hell. They're
Yeah,
just
yeah, yeah.
awful. Anyway, I had the surgery because all the frozen sections came back clean. They couldn't find any cancer cells. So we were all elated, and my God, big celebration, and and on the day I was leaving the hospital from that surgery, the surgeon came in and sat down on my bed, took one hand, took the other hand, and I'm thinking, this is totally not good.
Right.
And inside this hard-boiled egg, it was just like a yolk. It was like the outside was clean,
Yep.
and it wasn't fully, it was sort of off-center, and the whole thing was off-center, so until they did the full, complete pathology report, and by the
Right.
way, that's another very important person. Who
Absolutely.
is the pathologist?
Absolutely.
If you're having
Yeah.
surgery,
Yeah.
my God, this man saved my life.
Right, exactly.
He absolutely saved my life.
Exactly. There's a lot of pathologists out there that would love to hear you talking right now.
Because seriously, if he hadn't taken the time to do, I don't know, 128 slides or something, he found the cancer inside the scar tissue.
They are the unsung heroes.
They really are.
Yeah.
They really are. So, and I wrote to him, and he knows that I'm a big
Nice.
fan, and I talk to him
Nice.
about him to people all
Okay.
the time. So, thank you, because that was pretty important. So,
Yeah.
3 weeks later, I went and had the whole rest of everything,
Yeah.
taken out. But, and the only other comment that I probably have never made here about hope and about, being your own advocate, if you have to force yourself to get up every day and do whatever they said. I mean, they told me I had to walk so many steps 4 times a day. I thought they were out of their minds. I couldn't even hardly go to the bathroom.
Yeah.
And my husband, who is not here tonight, but he literally was Nurse Ratchet. But I mean, he made me get up and walk. And we walked, and every day a little more, every day a little more. So you kind of have to push yourself. If you lay down and just say, I'm not going to do it, it's not going to work.
Yeah.
You have to do it, and it doesn't always make a difference, but a lot of times it does.
Yeah.
It does. So anyway, I'm grateful to be here, and I love this group and the people, and it's very nice. And just wish everybody good luck.
Thank you.
Thanks, Ina.
Thank you.
Hi, everybody. My name is Stephen Coe, and it's 10 more days. It will be my first anniversary for my lung cancer. I was diagnosed with stage 4 lung cancer with a EGFR mutation. Actually, I was diagnosed in Vancouver. Last year, about this time, I was actually in Vancouver trying to do a short course up in the Vancouver area. And I was totally healthy, non-smoking. And actually, before my trip to Vancouver, I was hiking in Utah for 2 weeks. And then before that, I was in Toronto attending my cousin's daughter's wedding. So there was no symptom, nothing at all. And then about this weekend, I think in Vancouver last year, I felt quite sick. And turned out that my both lungs were full of fluid, and my chest fluid, my heart sac was also full of fluid. And I was taken to the ER pretty much on May 24th, that early morning. So it was pretty bad. The next morning I came around. The doctor was explaining to me the situation. It pretty much told me the night before. All my major organs are kind of failing, and I was basically they tried to get the water and the fluid out of my heart and out of my lung right away. Yeah. So as part of the checking the fluid, that they found out this cancer that I have, and because it's already spread, so I was basically pronounced stage 4. So my wife and my kids flew up pretty much the same day from California to Vancouver to be with me in the hospital that day. But I told the surgeon there pretty much saying that I do not want to get treated in Canada. Not that I do not trust the system in Canada.
Right.
Yeah, just because home is here.
You didn't want to live there. Yeah.
And then I know I have better support system around here. So they say, okay, fine. I mean, if I don't want to be treated, their whole objective in my stay in the ER in Vancouver was to get me healthy enough so I can fly back to California to get treated. So I stayed in that hospital for about like 13 days, yeah, and I was really fortunate. So I was healthy enough that I can fly back.
What did they put you on?
Yeah, I was about to say
or
that.
Tarceva?
Yeah. Oh, okay. Yeah, no, not in Canada. I was nothing. I mean, in Canada, I was just basically trying to get better, and also get my fluid drained from my lungs enough. Yeah, so there's not enough fluid, so I can fly back here to get treated. So I couldn't fly commercial, so I have to fly back on those like air ambulance that they call it. It's like a special jet. They have to have a doctor fly the flew with me. And I was still with all this chest tube on me when I flew back. Yeah. So at Stanford, that's when I went to, and I'm also currently being treated there. When I was admitted, because I was admitted to the ER and the ICU in Canada, so they have to hand me off at the ICU, okay, in Stanford. I mean, that's kind of somehow the protocol there. I mean, they have to have the doctor sign up to another doctor on the plane, and the doctor on the plane that they sign me off to the doctor at the Stanford to receive me. Yep. So, but I was actually quite well. So I turned out to be the healthiest person in the ICU that day, yeah, because I mean, I don't look sick at all. I mean, I only have chest tubes coming out of me, but I don't look sick. Yeah. Right? Yeah. So I mean, I know I'm sick. I know I have lung cancer. I don't look like sick.
You felt like you had to explain to people in the ICU.
I know exactly.
That
yeah.
you really should be
so they kicked me out of ICU that same day. Yeah. So I was moved to another, basically a heart unit. Yeah. Yeah. But during that few days, basically it was 3 days. It was a lot of work, tests being done. I mean, there were a whole team of surgeons from the heart surgery, from the pulmonology, I mean, from the radiation, from the oncology. I mean, the whole team. They put together a whole team, which was grateful to receive that kind of care. And the oncologist he was a fellow, a very good guy. I mean, at Stanford, yeah. So basically, came to explain to me what my situation with lung cancer is. Told me about kind of the possible scenarios of treatment, and I remember not liking any word of what he's saying. Yeah. So I also remember like I broke down at that point. Okay. Yeah. So just basically I don't think I know how to react to all the news. But anyway, so I was really fortunate being back in Stanford because I mean they are, like I said, was better support system. I mean I do have friends around this area. Either they have been through lung cancer with their families or with their friends. They came and visited me. They kind of told me about like their experiences and so on and so forth. And I also kind of slowly try to form my opinion about the disease and try to form my opinion about the treatment. And basically, I mean, stage 4, as a lot of you know, I mean, the treatment options are either chemo, I mean, the targeted treatment or immunotherapy. There's no way to do radiation, no way to do surgery from what I have, yeah. But looking at that, treatment options at hand. One, I mean, I stayed in Stanford for 3 days, but after those 3 days, I think the following month, I spent so much time, and I spent so much time on the internet studying about lung cancer. I really want to know this thing. I really want to know about all the various treatments. I spent so much time understanding and talking to people and so on and so forth. And at the same time, I'm also very curious about what can Chinese medicine do. So I can also explore a lot of the traditional Chinese medicine and talk to people. The reason why I want to do that because I knew of a few friends. I mean, they didn't have lung cancer; they have other form of cancers, and and suffer a lot. And at the late stage, and also quite a number of them kind of like they sort of at the point to give up and say, okay, I want to try Chinese medicine. So they did at the point of give up, right? So I asked myself, I mean, if I want to try Chinese medicine, why do I want to try Chinese medicine at the point where I'm giving up? Why I'm not trying Chinese medicine earlier in the stage? So I'm kind of constantly looking at that. And frankly speaking, here in the States, even I talked to, and I actually went to Stanford, but I told the oncologist at Stanford, I told him when they first see me, I say, I have not really decided, to have you as my oncologist. Okay, yeah. And he kind of looked at me, and I think a lot of people know this oncologist is a really good guy, I'm actually like having him as my oncologist right now, yeah. I got to look at me and say, okay, so what do you want to do? I say, I actually want to go and have second opinion about this, okay, yeah. And I told my doctor, I said, hey, I want to have second opinion, not that I do not trust what you guys have diagnosed, okay. Because the doctors in Canada told me about this. You guys have all the scans, and you're telling me about the same thing. So I totally understand what I have and kind of what I need to do. But I want to hear a second opinion because I want in my mind, I want to understand the philosophy of the oncologist, okay, why they want to choose one treatment versus the others. I know, after a while, I know when you're in stage 4, pretty much the formula is determined. You have to go through this, you have to go through this, it fails to go through the other stages, and so on and so forth, right? Yeah. And in my case, since I have EGFR, pretty much, I'm the best treatment in the science is Tarceva, okay, yeah. And I also, I know a lot of people don't trust the statistics, but looking at all the statistics on the PFS number on the online, and the median was for Tarceva was about 10 to 14 months, okay, yeah, before there was any kind of changes, yeah. In my case, actually, about 6 weeks ago, my cancer has also progressed. So it was actually 8 months and not quite 10 months. So I gave my oncologist a hard time and say, how do these numbers work, right? And why is mine 8 months, well, ahead of the curve? And then, even the median is between 10 to 14 months for Tarceva, right? And I guess I happen to be on this side of the curve, not on that side of the curve, yeah. And that's what this is, yeah. Again, I just find out in my treatment, I say, even though at some point when I ask the doctor a lot of questions, there's really not a whole lot of answers. They're really working as whatever the best science that can guide them to provide a treatment as to why things happen sooner, why things happen later. There really is no treatment. Okay, yeah. But nonetheless, I'm also very convinced that I'm receiving the best care because this is based on the best knowledge that is out there in the science right now, yeah, in terms of treating. So 6 weeks ago, I went and did other biopsy to figure out whether I have the T790M. EGFR, and I do have that, yeah. So right now I'm actually on Tagrisso, yeah, right now, yeah. Actually, tomorrow will be my first scan after I have my Tagrisso to see how that is doing. Okay. I have to say, in the last 2 months, I've been coughing a bit more, so I don't think that was a good sign. The oncologist was also saying that maybe the lung cancer is also kind of affecting part of the lung that causes the irritating the breathing. But the Tagrisso seems to help a bit, so I'm coughing a little bit less, but I still cough, yeah. So tomorrow and then Friday, I'm going to see the oncologist, and probably by then I'll understand the scan a bit more. But while I was having the progression, the major lobe is actually on my right side of the lung here, yeah, and it has other spots around the heart sac because of the I don't even know how to pronounce this word. I hate how to pronounce it, the metastasis. But 6 weeks ago, it has also shown up on my lower right lung. So for some reason, it has moved. Yeah. So I guess it doesn't like the immigration law here. Yeah. So. So tomorrow I'll find out. What's going on with Tagrisso, and then but I know I'm actually in the best of care. Right now, so I can complain. Yeah, but so far I'm also keeping to my doctor, second opinion doctor, actually in UCSF. And so I was seeing a doctor at a primary oncologist at Stanford. I'm also going to UCSF primarily. I want to compare notes. Yeah, I want to compare the philosophy of why one doctor. It's not that I do not trust my oncologist. I have to say one thing is, I'm also just taking Chinese medicine right now, as I always told a lot of my friends. I mean, telling them why I do certain things. I tell them I don't know exactly how this will end up. Okay, yeah. But I believe I've done enough research that I'm convinced that it's going to help me. If it's going to help me, I'm going to do it. Yeah.
Okay.
I mean,
Yeah.
yeah. But the thing is, if I'm not convinced, if I'm still finding like iffy about these things, I'd rather not do it. Yeah, because I know if I'm in that situation, if I'm not convinced, I don't think it will help me. Yeah. But if I'm convinced about certain things, I want to do it. Yeah. Even though I may not know totally what the result is down the road. Yeah.
Yep.
So
The integrative medicine,
Yeah.
I think, is for some people is a very important part, and you know, we encourage patients to explore the option as long as you're having conversations with your
Yes,
physician,
yes,
so
exactly.
that
That's a good point.
we're not
That's a good point.
counterindicating the treatments
No.
that you're receiving from your clinical team.
So yeah, that's a good point from me, because I do make it a point, whatever steps I take, I want to make sure my oncologist is very, very
Yeah.
aware of
Yeah.
that. Yes, it's important to me that he would agree, or at least would not disagree. But I also told my oncologist that at the end of the day, I believe the decision is mine. Yeah, which means that if I took it, if I screw up, okay, it's not because of did not tell you, because he didn't say no. It
Yep.
is that I decided I screw up. Okay, but that's it. That's how it is. That's because that's the best I know. That's the best I know how to do it. Right.
Yeah.
Right.
And but also I also understand I also have a Chinese doctor who is good enough to help me understand, at least to her best knowledge of the how the science works. I mean, yeah, because there's still a lot of like mystery between in terms of how the Chinese medicine works with the Western medicine, how it helps one another. But in cases there are those that helps, there are also cases that did not help. Okay, yeah. So, but those are kind of the information that I have right now that I can base on. Yeah. But so far so good. I mean, I'm still very
Well, you look
healthy.
awesome.
Yeah, thank you very
do.
much. Thank you very much.
And I
yeah.
think it's
So-
important to let you know, I was going to talk about it at the end, and I will again, but next month's living room will probably be very interesting to you because Dr. Colin Blakely from UCSF, who specializes
Dr.
in and
Blakely,
does
yeah.
his research in
Right.
resistance,
Yes.
particularly in the area of targeted therapies. So
Right.
he'll be talking all about that at June's living room.
Yeah.
And there's a lot of new work going on out there on PDX models and organoids, to actually take your tissue and look at it in a different way. So
Sure.
there's a lot happening, and there's
Correct.
a lot of clinical trials out there
Correct.
too now for progression. And we're big believers in mind, body, and soul. If you can keep your mind and your body healthy, and remain hopeful and open, and get great exercise, and those things can't be discounted.
Sure, I totally
Yeah.
agree with that. I totally agree in terms of the attitude. Of the person. Yeah. I also have to say, this is my third time coming to this group, and I'm really, really thankful and fortunate to have such a group, because I still remember the first time I was here, it was another roundtable with a whole bunch of patients sitting up
Yeah.
there, and
Yeah.
also a doctor, and I just felt it was so positive.
Yeah.
The energy here. So I just want
Yeah.
to say thank you to you all for having this. And then when I walk in and when I see that hope on that wall, such a big letter hope. That was just lightened up my night. I said that, yeah. And I'm
Yeah.
hearing the stories about people really, being able to they have hope through such group. I am very helpful, very happy. I have a small group of friends that have interacted also since the time no more of. Either themselves or their friend or their families having cancers. Actually, my cousin's wife is also suffering from stomach cancer in Michigan. Yeah, so we've kind of communicated a lot over social media and so
Have
on.
them
yeah.
dial in.
Yeah, I did. I
Okay.
did send in the link to some of them,
Okay.
actually, yeah.
Okay.
So, but I do want to say, these things, what you guys do inspired me a lot, okay? And I have a lot of friends that actually in the San Francisco area, and some of them they don't really like to talk about their sickness. They don't. I don't know. Maybe we're Chinese, we don't really talk too much, or they just hold it to themselves, yeah.
And
Yeah.
but they'll listen to you.
Yeah, they do.
Yes.
They do. They do.
And that's
They do.
That's
They
something
do.
you need to
And
do
I
more.
find it such an important thing. I think it's also a lot of them. It's also English are not as good. I mean, I have to be fortunate because my English is good enough to be able to go online, do my own research. I mean, try to understand. Even though I have to say most of the things I do not understand, okay, but I try to get the important data. That's all I need. I don't need to understand all the methods. I need to understand the results. I don't need to understand how current it is. I don't understand what the direction these results are trying to lead to. Right? So that's what I'm trying to get at. Yeah. But a lot of my other friends, either their parents, they're older. I mean, they don't really speak the language. They don't really have access to this information. So I was actually quite inspired, and I want to start a group. I think I talked to Kim here at the Lung Cancer Foundation.
Yep.
So actually, this Sunday, a small group of us are going together. We'll try to figure out how to start kind of a Chinese-speaking type of group. Primarily to do three things. I mean, to just be able to be a group or a platform that we can share experiences, share resources, share how to access resources. I know in San Francisco, I mean, in the Chinatown Public Health and also San Francisco General, they also have some Cantonese or Chinese-speaking materials that
Well,
we can get access to.
You know, our entire
I know you
handbook is
also
in
have
Chinese,
that,
so
yeah.
take boxes, take as many as you need.
Thank you,
Yeah.
thank
Yes,
you for offering
absolutely.
that. Thank you for offering that. Yeah. And still a lot of the advanced information are still in English here.
Yeah.
So I felt I can be a some kind of a bridge or try to interpret some of this
Yeah,
information, even though I don't
absolutely.
know exactly how to say that.
Yeah,
but I can
exactly.
at least describe
Absolutely.
to them.
Exactly.
So I just felt I don't really have much to keep me up at night. Okay, yeah, but I think just being able to think about if this small group can help just one or two people.
Yeah.
I mean to get them, not that they will. Again, I mean, I'm not a physician. I'm not an expert, but I'm just trying to be a
No,
bridge
but
to information. Yeah.
you
Yeah.
know more right now
True.
than
Uh-huh.
many physicians out there that
I wouldn't say that, but anyway,
What?
Well,
I wouldn't say I know more about
No.
You'd be
physician.
surprised.
No, you'd be surprised. You'd be surprised.
Okay.
And one of the
so-
things I love that you just said, because you used to say it when she first started this foundation, she said, if starting this and putting this all together helps even one patient, then it was worth it.
Right.
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 So I love
Right.
that you just said
Yeah.
that.
Yeah. So
I love that you want to do it. That's
yeah.
awesome.
Yeah,
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 that's great.
yeah. So,
we'll help you in any way. you
Oh,
need.
thank you so
Absolutely.
much.
Absolutely.
Yeah, thank you so much. Yeah. Okay,
We do
yeah.
have one video in our video library that's done all in Chinese.
So all of our edited living rooms in our video library are subtitled in Chinese and Spanish.
Right.
And then we did one voiceover, entire 2-hour living room voiceover with Dr. Gandera in Spanish.
That's so good.
You'll actually,
gonna tell a
love
funny
it. I have
story.
to tell this story. You'll all love this. Dr. Gandera is one of the most foremost thought leaders in lung cancer in the world. He's been the president of the IASLC, that's the International Association for the Study of Lung Cancer, blah, blah, blah. He's done living rooms for us many times, and I think he's due again this year,
Yeah.
right? He's amazing. He's up at UC Davis. So we asked him to come in and do a living room, and we had actually the interpreters in an office down the hall, and as David
Well, there was a last-minute change
it was a last
in
minute
the
change
actual interpreter.
in the actual interpreters. But anyway, long story short, they did an amazing job.
Yes.
And so the video came out with David Gandera speaking
It went
Chinese.
live.
It went live. David Gandera speaking Chinese with a female's voice. And I have to tell you, he was amazing about it.
Yeah.
He was absolutely amazing.
I know, he was really good about
And,
it.
he said, you know what, if it helps, that's awesome.
And there were
That's
actually
fine.
2 women, because it's 2
Yeah.
hours, so they were taking turns.
Yeah, yeah.
And it's,
Yeah.
the translation,
Yeah.
I wouldn't know, but apparently
Right.
it's tiring, right?
Right.
So,
Yeah.
so they were taking turns back and forth, and he's out here doing the whole thing in English, has no
Right,
idea
right,
what's happening in the back
exactly.
room, and I'm just like,
Priceless.
and it was a last minute female
Yeah.
versus male thing.
And
so.
we have some visitors from Pharma. They know who David Gandera is. I mean, he's a big deal in
Yeah.
lung cancer, real big deal. He was darling about it. It was
Yeah.
cute. We
Thank you
still
so much.
tease him
That
about
was
it.
a great
Thank you.
story.
Great.
Thank you. Yeah,
Thank you.
Yeah, thanks.
All right, Mr. Fred.
Mr. Fred, how about we have somebody in the back too. So
Yeah, we will. We're going
let's
to
not
make our way
forget to
around,
spin
and then
around.
we're going to go back. Yeah.
Fred, no, it's your turn.
My turn.
You guys hang on to that.
Well, my name's Fred Palmer. I was diagnosed with non-small cell lung cancer in October of 2013. And I'm currently on immunotherapy, as I've said many times. So that says something.
And Fred, why don't you share with everybody when you were diagnosed, what therapy you were on, and how it came to be that you're on immunotherapy? I think that's a good story.
No, it's been a long route.
Yeah.
It started out as a tumor on my right lung, pretty large. And so I said, let's just zap it. So I went on chemotherapy and radiation simultaneously. And that seems to have taken care of that problem. Unfortunately, there were spots on the left lung that began to appear. And through a series of biopsies, they determined that there was some ROS1 there. So I was on crizotinib for about 6 months. But when that didn't work, it became apparent that the mutation was more complex than just one variety. And so I went back on chemotherapy for a year. And when that ceased to be effective, I switched over to immunotherapy about a year ago. And I've been on it ever since, and it seems to be working.
That's awesome.
So
That's awesome.
very boring story, really.
No, it's not. No, not to the people in this room. It's not.
Fred it was 1 or 2 living rooms ago, maybe more, where there was a pre-scan moment where after starting the IO, or no, it was just a post-scan, where there had been what appeared to be some progression, right? And
Right.
your doc said, let's watch and wait. And then,
No, I said let's watch and wait.
oh, was it you?
Right.
Yeah, he didn't know
Okay.
what to make out of it.
Yeah. Okay.
We kind of put our heads together, and I said, it could be the fact that we're taking the PET scans too close to the actual infusion, and they're causing a pseudo-reaction.
Yeah.
And that may be part of it, because when we increased the interval between the PET scan and the infusion, things got looking a lot better on the results. But also, they put me on a steroid, prednisone, and that also is improving the situation as well, taking care of the inflammation. So everything seems to be working so far, so that's good.
You've been coming here a long time.
Long time.
Well, I want to come here a lot longer.
Yeah.
Yeah.
He's a graduate.
Hi, my name's Rick Bryson. I was diagnosed in February of 2015 with non-small cell adenocarcinoma. I'm being treated at Kaiser in Santa Clara. They actually found it because I had gone in for a different ailment, and they ended up taking an X-ray and saw a tumor in my lung. And within about a month, I had started on chemotherapy. You walk in and you get a diagnosis like that, and you just don't know what to do. I was working at the time and just trying to find out all the information that the doctor tells you. And even though my wife was there to transcribe, just finding, trying to find out if we're going down the right path, or what's, plan B and C if it comes to that. But at Kaiser, they use, I went to see pulmonologists and thoracic surgeons, and they submitted my tumor results to their tumor board. And so I started on carboplatin and Alimta. I did that for 4 cycles. And then I did 5 more months on Alimta only. And at that point, my lung and my lymph nodes were clear. They couldn't see any tumor at that point. But my adrenal gland stopped responding to the chemo. So since it was only 1 tumor, then they allowed me to be on a surgery call. And so they removed that. I moved over onto Taxotere for 4 more months. And at that point, in February of 2016, I was totally clear, no evidence of disease. So it's been just a little over 2 years now, And during that time, I basically retired from work and got out of doing an 80-mile-a-day commute. And the stress of work has really helped me a lot. And so what I'm doing now to spend my time is I go to the Y a lot and work out, and I do yoga to, rest my mind and give me peace that way. And I volunteer with American Cancer Society and drive patients to their appointments. And I go help at the food pantry with my wife. So that's what's filling my days. And I guess. Yeah.
Thank you for that story, because patients seem to feel when they're going on chemotherapy, which they all kind of think in terms of their grandfather's disease, chemotherapy can be a really good therapy to be on. So thank you for that story. It's good for patients to hear that if that's in their future somewhere.
Yeah, and I think it's incredibly inspiring how you're giving back.
Yeah.
And the choices that you're making there in order to make yourself just
feel better.
I'm not, my strength isn't 100% of what it was before, but it's, I do what I can.
Yeah.
And I know my limits. I know the new normal right now. But I actually had my second opinion was my oncology nurse that I had when I had testicular cancer and was treated at Stanford 30 years ago.
Wow.
So she had just retired a couple years ago, and when I was diagnosed, I brought her onto my support team and was able to get a lot of, reinforcement and telling me that the doctors I have at Kaiser are going down, a valid path. The difficult thing I had was they couldn't really tell me, because it's so fluid when your disease progresses, what your plan B or C, it all depends on what your genomics are at that point. So,
well, yes and no. Because chemotherapy can be a therapy that doesn't really require a genomic marker. Mm-hmm. And clinical trials, same thing. And, so,
Well, I think to going back to Fred for a second, immunotherapy, we just did our Columbus, Ohio living room, and Dr. Carbone from Ohio State University, who's also key opinion leader in the lung cancer space, talked a lot about immunotherapy, and regardless of mutation or fusion or whatever you may or may not have, immunotherapy is quite often a very good option for most patients.
And what we know today that we didn't know even just a couple years ago, that you might start out with an EGFR, a ROS1, a MET, a RET, a HER2, a BRAF, whatever. But once you progress, what are you now? Are you still an EGFR mutation patient, or are you something new? And maybe at some point along the road, when you no longer have a visible mutation, maybe that qualifies you for immunotherapy. We don't know.
And we've also known patients who didn't necessarily present with a mutation, but down the road, post-treatment, all of a sudden, they were rebiopsied, retested, and then a mutation was there. So it's all about what the process looks like and the pathway of care, I guess, when we're talking about progression and what needs to happen at progression to ensure that the very next step is what's right for you. To the points that were being made early on in the conversation, it's so incredibly personalized based on your cancer, because your cancer is not the same as Fred's, it's not the same as Dave's. I mean, it just isn't, right? So
And we've seen people with diagnosed with an EGFR mutation that are tested later upon progression and have an ALK mutation. It's not really it's not really out there in a big way, but it happens. Or they have a HER2 mutation, or
BAC patient who
Yeah.
was treated with various forms of chemotherapy for 5 years, a stage 4 patient, before
Yeah.
they found the ROS1 mutation.
Yeah.
I mean, there's just all these different things,
Yeah. So hope,
Yeah.
hope drives you to get the information you need to keep going, and it's very important.
Yeah.
Yeah.
Lots of good things happening in lung cancer.
Yeah, and so the stuff that keeps me up at night is basically the fact that I retired 5 years earlier than I planned to.
There you
and,
go.
You
Yeah.
know, and is it going to last? Or if recurrence comes, what kind of resources is it going to take?
And I think that's a good point too, Rick, because we hear all the time that patients sleep better at night knowing there's a plan B, C, or D, wherever they might be in their back pocket, right? Knowing that what their potential options for next steps might be upon progression.
Right.
One of my favorite quotes these days, and I've said it before in the living room, and I'm going to say it again just for you. When you reach back for yesterday, you invite depression, and when you overlook the future, you invite anxiety. And it's good to educate yourself. It's good to get second opinions and all of those things. But the best thing you can do for yourself is stay in the moment. It sounds trite, but stay in the moment and enjoy every day, because none of us really know when we're leaving.
Right. Exactly.
Thanks, Rick.
Thank you.
Mr. Dave.
Okay.
David.
I was diagnosed
Joseph.
14 months ago yesterday, and just maybe a week later, I was here for my first living room, as many of you know. I brought a couple goodies with me. By the way, I'll get into my diagnosis, but I have a box of these ACP dry mouth we are all taking a variety of different drugs. So if any of you are experiencing any kind of a dry mouth situation, come grab a handful. You can buy these for yourself, but get a handful of them. They really work well. I've found them to be a huge help. Tarceva, which is what I'm on, does create a dryness. I also have a few brochures of the YMCA's Living Strong, Living Well program, which is for people who have gone through a variety of typically chemo-oriented treatments or radiation and have become much weaker than normal and need to start, once they have leveled off and they can start rebuilding their strength, the YMCA and Stanford have this joint program. It's free to us cancer survivors, and it's in YMCA's, I think, from the city all the way down to San Jose, so up and down the peninsula, and maybe in the East Bay too. So I have a few of these if anyone needs. I was diagnosed stage 4 with EGFR mutation and was immediately put on Tarceva, as well as I had 6 lesions in the brain and had the SRS to alleviate that. And things seemed pretty good for a while as I was going along. About 6 months into it, there was some swelling that had occurred from the SRS in the brain, and I had a focal seizure. And this focal seizure, I lost my ability to speak for a few minutes, and slowly it came back word by word, sentence by sentence, paragraph by paragraph over the next several hours. 3 hours later, I was having lunch with my wife after a quick ER trip at Sequoia. But it was a pretty scary thing at first. I have not had another seizure, and I take an anti-seizure medicine now that has become part of my everyday life that I take called Keppra. And it's a very low dose, and I have no real side effects to that at all. The side effects, typically we get from Tarceva, if you're on one of these targeted drugs, for me seem very mild, and I'm thankful for that. We have the skin rash, which I've learned to control better. So I think if you remember me from earlier times, either on TV, on the video, or live, the rash was various stages of raging at some points. The fatigue is, a constant, as you said. We don't have the energy we used to have, but then we get older and we usually don't have that energy anyway at some point, And then the third is the stomach, is a little touchier than it used to be. And I think that's from the Tarsiva as well. But other than that, my day in, day out is pretty much, the same. About 11 years ago, I became a volunteer teacher. I'm not sure if I shared that at all, but kind of touching on what some of you have talked about. So I teach English as a second language for conversational to a variety of different people in a group setting, and also music appreciation. So this is a true give back and really enriches the life, as you had said, Rick. When you give a little, you get back in spades. It's really great. So that is something I've truly enjoyed, and like I say, it's my 11th year. I typically have anywhere from 20 to 35 students at a time. So, and I get to call my shots as how often I want to do it. It's a volunteer thing. I set the schedule. If I want to take a vacation for a few weeks, no problem. No class for a while. So anyway, that's been good. I've also brought a book because, Bonnie, as you said, it's the heart, the mind, the spirit, it's all together. And there's a book I'm reading, I'm about halfway through, called The Power of Kindness. And I don't know if any of you have heard of this, and I'm not sure who referred it to me. Usually when I get something like this, I've started making a list that so-and-so gave me this book, or so-and-so gave me this recipe for something really good to eat or whatever, as kind of a thank you, so I can remember once I finally get to it.
Yeah.
Because some of the books, if you get a book and you might not read it for a few months, your head's not quite there yet. But this one has been great, and it's the unexpected benefits of leading a compassionate life. And it's just all about the same kind of thinking.
So, Dave,
So important.
What I want to say, because it's important when we're talking about these books and sort of paying it forward with this type of information. So Kim Shapoyster, who some of you may have met here, she is sort of the mother of our office and make sure that everything runs really smoothly. She takes our patient education handbook, and around town here in San Carlos, we have pay it forward libraries, if you will, where people have boxes in front of their houses, and we'll just stick books in them that anybody can come and take, and when they're done with it, they stick it in another box, and everybody rotates and shares back and forth. And Kim has multiple times put our handbook in there that always disappears. Yeah.
Great.
So you might want to consider that when you're done.
Yes.
Putting it in one of the pay it
Yes.
forward library boxes.
Yes.
I actually even took, for my English conversation class, I took excerpts that I found online from this, because it's hard to cut and paste from a book.
Yeah.
Yeah.
Right? And I have class notes for my students.
Yeah.
And so I found excerpts on a variety of the chapters in here and was able to cut and paste that from the internet into a Word doc, which I then could hand out to my class
That's
of
great.
25 students.
And
that was
Dave,
great.
if you do put that in the pay it forward box, put a note on the self about who you are
Oh, yeah,
and
you
why
should
you
write a little
were
something in
paying
the-
it forward.
That's a great idea.
Okay.
That's a
Yeah.
great idea.
Yeah.
I've even thought of actually buying a copy for all my students.
There you go.
So
Yeah.
might be in
Or all your lung cancer patients too. Who knows?
That's right.
Yeah.
The chapters are really great. Each one is a true lesson. Take it to the dog
Take it to the
park.
dog
You never know who
Yes.
you're going to meet at the dog
Yes.
park.
We always laugh about Dave because he found us in the dog park. Our finance person, who is also my daughter-in-law, was there with her dog, and she met Dave and
Actually, not me, my wife was there with the dog.
Dave's
Right.
wife.
And so
And she
I
said,
got
"Oh, you-"
diagnosed on a Tuesday,
Yeah.
and it was I think it was Wednesday.
Yeah,
Barb
yeah.
was at the dog park
Right.
and met your
Debbie.
daughter-in-law.
Right.
And next thing you know,
Right.
I was here meeting Michelle on
Yeah.
Friday, and then I
Right.
was here at the living room
Right.
the following Tuesday.
And so really, are coincidences really coincidences? I don't think so.
Right.
Right?
Right. So anyway, thank you. This group has been a treasure for me. I have found now that it's been over a year, and the difference between how I was when I first came, and many of you who've been here for the long timers, you remember me my first and second time around, and kind of the sadness you feel. I think that was the overwhelming feeling that I had. I had a 60th birthday party last May thank you, Ron, where we had a bunch of friends get together. There might have been 35, 40 of us. And a friend of mine from college came out. And I just saw her last month in Chicago, which is where she lives. And she was describing how far she said I had come. from when she saw me in May, 2 months after my diagnosis, to last month, basically a year after. And she described in one word, she said, sadness is the only word I could think of to describe how you looked and felt and acted and how you were. And I've now learned how to live with my disease. I've learned how to think about things in a positive way. And that's really, it really is huge. And in this room, this group of people that I've met, you all have incredibly inspiring stories. And most of you have been through much more than I have been so far in your treatment lines versus what I've been through. But I also understand that as individualized as all of our cancers are, that we have to kind of expect the unexpected. We never know at any time things could take a turn and go a whole different direction. So instead of focusing on the future and getting anxious about it and thinking, where's my cancer going to go, I kind of live in the moment.
Yeah.
And it's been really, I would say, medically helpful for me.
And also so helpful for people that aren't sick. If we
Yes,
could all...
you don't have to have cancer to think this way.
If we could all get to
helps.
that place and stop watching CNN and doing all kinds of things.
Turn the news
right?
off. Turn the news off.
Right.
Yeah. There is no news in this power of kindness.
Right.
No.
Right.
No.
Well, this group should be on CNN. Wouldn't that be
Yes, that's
refreshing
right.
to the world?
Right.
listening?
That's a whole nother topic
That's
for a
a
whole
whole
nother living
Do you
room.
have a question?
We'll have a cocktail with
Just need
that.
to can you grab a mic so that we can hear it? Sorry. Do you have one back there?
They don't want to talk.
She just has a question.
Oh, okay.
I just wanted to just to say hi before we ran out of time, if that's okay. I didn't mean to interrupt anyone.
No, sure.
Okay. We're not forgetting you, though. I
Yeah.
We're
promise.
not forgetting you,
Right.
Dave. Sorry. I really didn't mean to interrupt.
No, you're fine.
Okay, so anyways, so what I was wondering is that, because I watched a couple prior in your library, which, Bonnie, I haven't watched in like 13 months. So in a way, there's guilt for me for that, but I don't want to start crying. I'm doing fantastic. My treatments are great. I've been on Alecensa for 2.5 years. I have ALK, and one of those shows I seen in the library, Bonnie, you commented something about alkies, and there's a Facebook page, and there's 1,000 people on that.
Yeah.
And I want to know how to get there, and
Okay.
I want to be able to write it down because I tried looking for it on Facebook and I couldn't find it.
Okay.
We can help you.
Okay, we can help you do that. Absolutely.
Tell everybody
Absolutely.
how far you came to be here tonight.
We came from Sacramento. Actually, we live a lot farther than Sacramento. We live in Colusa.
That's farther.
It's an hour farther
Yeah.
north. I told Brian that I wanted to come. We came about 1.5 years ago. And
Tissues, Kim. Tissues.
Kim's got tissue.
I just want everyone to know who's watching, who sees me, that there is hope. There is hope. And I have been fighting for 4.5 years with lung cancer, and I've done very well with everything that they've thrown at me. I started with chemotherapy for the first 7 months. They said that there would be a 30% chance that I'd survive. So, not survive, but be gone. See, it's metastasized to my brain 2 years ago. The Alecensa works very well, but I can't communicate as well as I used to, which is okay. It really is okay. Because I'm alive and I feel good. I know I look good, other than this little scratch I have on my nose, but I don't feel like I have cancer. I've been on 3 targeted treatments. I've been very blessed. I go to UC Davis. I have Dr. Reese as my oncologist.
You're in great hands.
I am in great hands, and he does talk to. I ask him every time I see him, because the thing that's worse for my lung cancer is the metastasized to my brain. It's called leptomeningeal, and it's even rarer than ALK.
Mm-hmm.
But for some reason, I'm here and I'm fighting, and it's been 4.5 years, and I don't think I'm going anywhere anytime soon. I just had to come. I just had to talk, and I always cry every time.
That's okay.
I cry.
That's okay.
I cry not because I'm sad. I just cry because the words of cancer, lung cancer, it would make people cry. It's reality, but now I'm just kind of rambling.
No, but you're in a room with people that understand how you feel, and sometimes that's most important, than anything else on any given day. Just for people to really understand. It's one thing for people to say, "I know how you feel," but the people in this room really do know how you feel. So,
Yes, so thank you.
Thanks.
thank you, Pumpkin.
Go ahead, yeah. Do you have we just need the mic. Thanks, Ed.
Okay.
I discovered I had good news, bad news. I thought I was having a stroke. Went to the ER. CAT scan showed no stroke. Bad news was 2 lesions on the parietal lobes and on the lung. So that was my story. I stuck with it with the kids. Said, this is great news.
Have a stroke.
No stroke.
No stroke. This was late February, so I've had the cyber knife at South San Francisco Kaiser. The best thing was when I got the MRI from results after 5 days, and the Dr. Gillis called me and said,
She's great.
no sign of any spread, and no, excuse me, and no sign of the recurrent, of the original.
Metastases.
So that was great. It was the first time I'd slept in more than about 4 hours since I'd gotten the original diagnosis. I slept almost 10.
Mm-hmm.
And, so on chemo, still optimistic.
What chemo flavor are you on?
Don't
Flavor.
remember, it's 30 minutes and 10 minutes.
No, but what carboplatin,
know.
cisplatin?
He doesn't remember.
I don't remember.
Okay,
It
well,
doesn't
cool.
matter to me.
That's okay.
Yeah.
That's all right.
Yeah.
You should ask sometime, though, just
No, I
in
mean,
case.
I know it. I just
It's somewhere.
Yeah. Only because, and we tell patients this all the time. You really need to know all of those things, because if you're out and about and, end up in an emergency room or needing to see a doctor for whatever reason, you might have just, cut yourself or whatever. You need to be able to express that to, whoever might be treating you.
I think,
Yeah.
because you're 2.5 months into this, right? So it's still pretty new. And Dave just said 2.5, 3 months in at your birthday party, you are not the person you are today. So it's completely normal for you to be in that place, right? Where
Yeah.
you're still sort of blown out, not really processing what's happening, just kind of going through the motions. But we're so glad that you're here tonight so that you can hear these stories, so that you can come back and talk to us. And I know you talked to Michelle when you guys first came in. We can help you to ask the right questions so that you do become that patient that knows every single thing there is to know about your cancer,
Right.
To help you have those conversations with your doc. So,
And I want to thank my sister, who knows Dave, for making the introduction and getting me here. So
that's great.
thank you.
Thanks for coming.
Thank you. Thank you.
Wayne, do you still have your
We're
mic?
here for you. Okay.
Hi.
For anything.
My name's Wayne, and my wife, Rebecca, over there, was diagnosed with stage 3 non-small cell adenocarcinoma in November of last year. Late December, we started treatment, which was radiation and chemo. That finished in February, and about a month later, our oncologist at Stanford decided that it would be wise to put her on an immunotherapy drug, durvalumab. And we've been on that for about 6 weeks. And right now, we're really just wondering what's been happening because we haven't had any scans or anything.
But how are you feeling?
How are you feeling?
I feel better than I did before.
Okay, that's a good sign. That's a good sign.
And they were talking about putting me on steroids, but Wayne said no.
Wayne said no.
I kiboshed her steroids for her pneumonitis. I think she was getting better, and I think there was a big part of me who felt that, whatever slim chance immunotherapy would have, it shouldn't be interfering with something that was monkeying with her immune system at that time. And she believed it. So she's still coughing.
You sound like my husband. He used to demand to come to be with my doctor appointments. And my doctor would ask me something, and he would say, no, she's lying. That's not true. This is exactly, and I'm like, shut up.
Coughing, blah, 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 blah.
Yes, it's so annoying, right?
My favorite is that you don't have that much cancer.
He says that to her.
Because Dr. Neal said, you have millimeter nodules, and he says, little spot here, little spot there. And
They were saying at the last living room, when she complains about something, he's like, you don't have that much cancer. Wow.
Right. Yeah.
And so, it is.
It's a privilege she lets you into those appointments. I'm just telling you right now. Right?
Who else is going to drive?
Right. Uber. We'll take her.
But, those little millimeter spots do keep me up at night.
Okay. There
I
you
don't
go.
know what they
So,
are, right? And we don't know if it's inflammation or whatever it is.
They told us inflammation after the radiation, and then they told us inflammation because of the immunotherapy, most possibly. Things seems to be growing all the time and not really shrinking. So,
Well, you guys were here, it was last month, right, when Dr. West was here talking about the immunotherapy and all the itises and the inflammation that goes along with it.
Yeah.
and another thing too is we weren't lucky enough to get a good biopsy for Foundation 1, so, and hopefully we'll be able to do that after the next round of scans. They'll go ahead and do another biopsy and see if that, and for right now, no markers and no.
Okay.
Or preferably not enough to take a sample.
Right. But we've talked about that too. I mean, the big hope is that the immunotherapy that you're on is going to be working, and you're going to stay on that, and that you won't need to rebiopsy.
Right.
Wait, but immunotherapy, does that actually make you feel better?
Yes, absolutely.
Yeah.
Pretty quickly too. So
Okay.
yeah. So
I just
Well, it
figured I
can
was
and it
feeling
can't.
better that the radiation chemo was, finished.
How long have you been on the IO?
About six weeks.
Yeah.
So
And they're going to rescan in probably another 6.
in another month or so,
okay.
And so,
Yeah, just listen to your body, and if you feel like you need to run in and see your doc, do it.
Yeah, so one of the big things that are, again, kind of going back to the shared decision making, but a big sort of topic, and especially in some of our partnerships with our industry partners and whatnot, is talking about these, what they refer to in industry as adverse events, and what we just talk about as side effects, right? And so really paying attention to what those side effects are and not waiting to have those conversations, whether it's with your physician or with your nurse navigator or anyone on your care team. David, you need to grab a mic. I'm happy to.
Should I have you, if you're done with that comment, to remember the registry as well?
Yeah. Because what we don't want is for you to wind up in the emergency room where, God love the docs and nurses that work in there, but they aren't best suited to treat your potential side effects from your cancer. So really, really, really important that you have those conversations with your oncology care team before you need to get into sort of an emergency situation. And to David's point, we do have a study going on in our registry right now looking at adverse events, regardless of what type of immunotherapy you're on. So we highly recommend, if you are on immunotherapy, to go in and fill out that study form.
Do we have dial-in information for?
It's lungcancerregistry.org. We can talk to you about it after, and we put it up on the lower thirds, typically at every living room. But we can have a conversation about it too. Yeah.
Thank you.
Thanks, David. Do you guys want to say hello and say who you are and why you're here?
Who
'Cause
are you
I think it's
people against
important
the
too.
wall?
We just need to get you a mic. And then we're going to go to anybody online.
Hi, my name is Jennifer Yeager, and I'm with Bristol Myers Squibb, and I'm with my two counterparts, Taryn and Nicole. I'm newer to being in this industry and learning more and more about oncology, so hearing all of your guys' stories, and it breaks my heart, but it's really neat to kind of see the different pathways that you guys go through and just have a better understanding, so that when we are talking to the doctors and working with the community, having a better understanding of how we can help support doctors and organizations like this to help support you guys. So thank you for letting us be here. And
Do you guys want to say anything? Are you good? I think it's important to note, obviously, there's an open door policy here, so anyone who has an interest in lung cancer is welcome, regardless of RSVP.
But also to know just about the BMS people, Bristol Myers Squibb has moved all of their immunotherapy work like 5 miles from here.
Yeah.
And they have 4 buildings that they're doing nothing but immunotherapy.
Yeah, and what I was going to say is I think what you all need to know in the room, by you guys sharing your stories and your journeys, you're helping them to figure out how to do better what it is they're doing, how to do it better and how to do it faster. Your voices matter. We've been saying that since day one. And so we love, love, love having industry in the room to be able to hear from you all where you are and what your needs are. So thank you guys for coming. Michelle, do you have anything from anybody online?
Well, there's a lot of people online, and actually it's nice because they're chatting amongst themselves.
Oh, good.
We are.
They're having their own support group meeting.
We do have, Melissa said, what keeps her up at night is hoping this becomes a chronically managed disease for all stages and types way before 2023.
Nice.
And then Julie just wanted us to know that we're all great at guiding folks, making gentle suggestions without being overbearing or critical. Fabulous skills coming from a counselor.
Aw.
That's great. That's great.
Very sweet. So we had a couple of what keeps you up at nights, but not really a ton, right? I think we kind of covered them sort of as they came, with the exception of senior parents and children going off to college, and I completely share that keep you up at night, because my youngest is going off to college this summer, and my husband and I joked that I don't know if I like him enough to live in the house without children. I'm not sure what we're going to talk about. We keep joking about it, so I completely.
You just get a lot of dogs.
Yeah. We already have a lot of dogs. But I guess we talked a little bit about people worrying about progression or plans B, C, D, or E, or whatever that might be. And I guess my question is, where do you guys go with whatever your challenges might be? Like, who do you bounce that off of? I mean, obviously you use this as a space, but to sort of Dave's point, this is once a month, and of course you can call whenever you want, but where else do you find that support? And Ron, you said sort of that support group is called co-something. What did you call it? Sorry, you don't have a mic.
I was saying that caregivers can also be known as co-survivors.
Co-survivors. And I think the caregiver, whether it's a spouse or a friend or a family member or people you meet in a support group or foundations, where do you guys go to find that hope, other than when you walk in and see it just really big on the wall?
Can I just
Anybody?
add something to the end of your sentence?
Sure.
That's very important, but where do you go when you're scared and you don't want to scare your family?
Because you were a big
Where-
fat liar a lot.
I was a big fat liar.
That's true.
And so where do you go when that's keeping you up at night? And we had somebody, they're probably online, they're always online. And the husband who was married to the lady that was, we'll just call her Jane, who had lung cancer. And he came to me one night and he said, Bonnie, he said, where do I learn how to chat with my wife and my daughter about this? We all have different feelings and we're all kind of walking around and we're living our lives. But I think, we're just not sharing. And I said,
keep going.
You just have to get the pink elephant out of the room. You have to tell her you're afraid she's going to die. And she has to tell you she's afraid she's going to die and what is going to happen to you if she does. And then you both have to talk to your daughter all in the same room and say, you're afraid too. So let's talk about our fear and let's see what we can do to deal with that.
Yeah, and I think that's so important because it's the person diagnosed with the cancer is not the only one necessarily with the fears, right?
Everybody has cancer.
Yeah.
In the house.
Everybody has cancer.
Yeah.
Yeah, and how to have those conversations.
Yeah.
Fred, do you have a mic?
Where do you go, Fred?
To get completely off the subject.
That's okay.
I do have a question I do want to ask.
Yeah.
I received the notice that the foundation is partnered with SITC.
Yeah.
And could you explain what that involves and what benefit that's going to have, for members of the foundation or people associated with it?
So SITC, who Fred is referring to, is an immunotherapy group. Society for Immunotherapy I don't know what the C stands
Of cancer.
Cancer, thank you. Because they work in immunotherapy across all different cancer types. And we've partnered with them in various ways over the years. One, if you go into our video archive, you'll see an animated video really kind of in the lay person's terms explaining what immunotherapy is and how it works. So we advised with them on that and what the scripting might look like and all of that. So that was number one. Number two, they are partnered with us on the study I was referring to through our lung cancer patient registry, where we're trying to better understand, because immunotherapy is so new, we're trying to better understand what the side effects are of that and how best to treat them and how to navigate that part of the process. So those are the two major ways that we are partnered with SITC.
Okay, and the information is on their website, is that correct?
Yes, all of their information, all they do is immunotherapy. So if you can't find it on our site or other Lung Cancer Foundation specific sites, SITC will have the information for you.
Okay, yeah, I just wanted to clarify that, that's all.
Yeah.
Okay.
Absolutely. Dave, did you have something? You need a mic?
Dave, you need a mic? Dave.
Bonnie, I want to jump back to what you were talking about just a second ago.
Okay.
And, to get all the family members into the room and talk through this cancer thing. And I think if you take it even further, and we think about ourselves as parents, if most of us are parents or grandparents, and if we have children, we have a responsibility to teach our kids how to live their life.
Yeah.
Right? We're going to teach them all the lessons. But we never really think about teaching them about how to die or how to live your life as a cancer patient, how to live your life with a death sentence, if you will.
Right.
Knowing that it's not just cancer, but we're organisms and we're all going to die at some point. At what point do we teach our family members this lesson? And so for me, it's become kind of clear as my role as a parent has changed, my kids are 25 and 30, that instead of hiding behind fear or thinking about all this in a negative way, is to think about it in a positive way as how I can continue my parenting with them, and they can see how one lives with a deadly disease. They can see how one prepares themselves at some point for their demise. And you don't have to be morbid about it or be fatalistic about it, but it's really kind of a kind and gentle way to kind of view things.
Right.
And so there's a beauty to it, just like there is a beauty to teach them to walk and talk and throw a baseball and all those different things. So, getting them in the room is the first part, and that's just step one.
I think that's a really interesting point.
Yeah.
Being a parent and having been a child and growing up. In health classes, they teach you about birth. I mean, two certainties in life. Certainties, birth and death, right? Two certainties in life.
taxes.
Everything else, and taxes. Everything else in between, right, is an unknown. And when you talk about health ed classes growing up, it's the birds and the bees and birth and all of these different things and how to stay healthy and take care of your heart and eat right and exercise. Nobody talks about the other certainty, right? Maybe in theology, right? In some theology classes, but for the most part, they don't. And you got to stop and wonder why. And I think you said it, it's fear. People are afraid. And we're all none of us are getting out of here, right? I mean, we're not.
But
really interesting.
there is one beautiful thing that happens, and it's you have an alert that something negative could be on the horizon. So it gives you an opportunity to tell all the people you love and to do things like we're doing tonight, to write notes, to do, to blog, to do lots of different things. To your point about the beauty of kindness, I can honestly tell you, I always thought I was a really good person, but I really know now that I am a really good person because, well, except for my kids, because I have let go of so many things that I thought were important to me before that may have been negative or whatever. And I only invite kindness into my life, and I only give kindness. That's a beautiful thing. I don't think I would be this person today if I had not had a cancer diagnosis. So I think you have to look at it and, embrace it and turn it into something as fearful as it is. See what you can do with it to make it better for maybe some other people, including your children and your wives and husbands. And
I can actually say that's a true statement. When we go on family vacations, there's 18 of us with kids and grandkids and everybody, and we all stay in one place. And this is a woman who, and I'm going to poke fun for a minute, but I love you.
Okay, it's okay.
She couldn't sit and have a conversation if she saw a piece, like a dust bunny, across the floor. She would have to pause, get up, walk across the floor, she picking up the dust bunny and then going back to the garbage. And now it's like the kids are leaving stuff everywhere, and she's just like, it's fine.
Yeah,
so
not important.
that is a true statement.
Yeah, true. Yeah.
It's great to release all of that.
Isn't it? Yeah.
I have given up.
So freeing.
We worry, as parents, we worry about our kids at any age.
Right.
Whether the kids are 30 or 40 or 50, if we live long enough and our kids are behind us, then we're going to worry about them.
Right.
But once I was diagnosed and I kind of got through that initial shock, if you will, the first several months, now my thinking is much clearer and I view them, there's no worry.
Right.
And so I don't make judgments about them or their future or what they're doing is right or wrong. I'm here to help if they need advice.
Yeah.
But I don't push my thoughts on them like I used to, as a normal parent might do. And so it's very freeing, as you said.
And the reality is that all you really want for your children is for them to be kind and for them to be thoughtful of others and for them to be good people. They'll figure out the rest.
Absolutely, because you gave them the tools.
They'll decide what to be when they grow up.
And I can say, too, that not in comparison to having been diagnosed, obviously, but having worked in this space for, 9 years or so, even and hearing all of your stories and feeling so incredibly inspired by each and every one of you, it's really changed something in me where I don't have time for certain things that I would have given time to before, right? Like, it's just that's the most important thing going on in your life, really, right? That seems to be sort of more of even my attitude in just being so involved in this space. Ron, I see you with a mic.
Go, Mike. Go, Ron. Go.
I've already forgotten what I was going to say.
Oh, man.
But
welcome to my world.
and I don't even have, I haven't taken chemo. So, but it's the issue of, there's that poem where you look at the tombstone
You see the year to birth
The dash.
and the year in the middle,
dash.
at the end, but the dash, that's where we need to live and
Yeah.
figure out how to live. And,
Yeah.
and that's where the health class hasn't really done well for us.
Yeah.
I would say that cancer was really good in a way because it was a wake-up call. A wake-up call to not just run around doing things like you said, but do meaningful things and meaningful time with one another. And so if there are strengths to build upon in your family, we are able to build on those. If there are fractures in your family, and which family doesn't have some fractures or stresses, we're able to try to resolve some of that. And most of all, we're able to strengthen our faith. And I think the faith is what kept Joan and me going as much as anything else.
Yeah.
Thanks.
Yeah.
So thank you, Elm. And just so you understand, tonight we're bringing coffee crunch cake from Chinatown.
I mean, if you guys haven't seen it,
Oh my
it's
God.
unbelievable. Is
Speaking
it
of the
toffee
dash.
that's on the top? I don't even know. I
So,
was like,
so there's
what?
this famous store called Blum's in San Francisco that doesn't exist anymore.
Yeah.
And
Yeah.
one of their signature foods was coffee crunch cake. So signature food, see, we're living in the dash right now.
Right, exactly. Exactly.
This cake, so when it went out of business, we know
Oh man, she almost dropped it. She almost dropped it.
we know 3 restaurants that, 3 bakeries that took on the recipe and tried to recreate it. It's not quite the same as Blum's, but it's pretty darn close. This is one of them. It's called Great Eastern Bakery in Chinatown on Grand Avenue.
Yeah.
And
Sweet stop in Japantown.
Nice.
Okay.
All the good desserts.
There you go.
Okay,
There you go.
okay,
She
Sally. One more,
does,
right?
She does.
Okay,
She does.
Sally.
There are a couple here on the peninsula. One didn't equal the one, but
Deanda's up in San Mateo is pretty good. Yeah.
But anyway, Sal and I have in this debate, what is the legacy of Blum's coffee crunch cake? I swear by this one, our family lives in the dash by having everything we can celebrate by going down and getting some coffee crunch cake.
Awesome.
So
Okay,
I brought
there
some
you go.
down to
There
help
you go.
celebrate
There you
life
go.
tonight.
Didn't Blum's
Thanks,
have the candy as well?
Yeah, so
My
this
grandmother used to buy the little chocolate mints in the squares, and they all had little tissues between them. And then she would hide them in her in the living room,
The buffet.
So when we kids went over there, they would always be in a different place. But we would look for the Blum's candy.
That's funny.
So the coffee crunch is the hard nuts that you are
It's like
brown
toffee,
sugar
right?
with coffee in it, and
Yeah.
and it's
they were known for they had a Sunday, a coffee crunch Sunday. I told you I know food.
you're talking to a couple San Franciscans here. Anyway,
Negative.
please enjoy that and
That's great. Thank you for bringing it, Ron. So we are almost out of time, and of course, you guys know I always end with some housekeeping and some really important things to talk about. I'm going to start by saying that several members of our team are going to be heading off to ASCO here in a couple of weeks, where they're going to be learning all about the latest and greatest things happening in lung cancer. And as those of you who have been here for a long time know, that come July, we hold our own sort of best of, or what's the most important thing to come out of ASCO for you. And at that meeting here, Dr. Amy Moore, who some of you may have met, most of you probably haven't, who I know we all miss Gannett terribly, but Dr. Moore has come in to take over that role, and she's absolutely fantastic. She's from Georgia, and she and her family are relocating out here, and I can't wait for you all to meet her. So she's going to be sort of debuting, doing our living room best of ASCO at our July meeting, along with Dr. Hatim Hussein, who's a medical oncologist from University of San Diego, UC San Diego. So we're going to be really excited to bring you that. Our Dallas 5K, for anybody who online who might be signing in from Dallas, if you haven't signed up to come out to our 5K event, that's on May 19th. Our Chicago, where Michelle and I and some other folks, like I mentioned, just were last week, doing our living room out there. Our Chicago event is on June 10th, and that's also going to have a kite flying feature, so nobody needs to walk and or run the 5K if they don't want to. And are you going to be in Chicago? Did I know that? Okay, so Dave's going to be in Chicago.
He gets around.
Our golf tournament here is on June 11th at Green Hills. So anyone interested, please see Jennifer. Our June 19th living room, as I talked about earlier, is Dr. Colin Blakely from UCSF. Like I said, his main focus area is on resistance to targeted therapies and what might that look like second, third, fourth, generations
He's
down the road.
going to tell you about all the places to go
mhm.
upon progression.
Yeah, and a patient that we work closely with who is an EGFR resistor from Sacramento is going to be joining him on the panel, Terry Kennedy. So if Terry's online or Colleen or anybody, hello to you guys. And then our Sacramento 5K is June 23rd. So that promises to be a really, really exciting event too. For those of you who have not attended one of our events, obviously it's about fundraising because we need to do that in order to move the needle forward in this space. But more importantly, it's about bringing patients together in an environment where they can share hopes and successes with one another. It's a great, great, great event. Marty, I see you nodding your head. I hope to see you guys in Sacramento as I have before. Yeah. Yeah, it's a really, really, really great time for everybody to get together, like I said, and celebrate the successes. So I highly encourage you guys to do that. Did you want to say something?
No, our San Francisco run in.
Oh, that's not till September.
I know,
we'll get to that.
But Lucy Kalanithi, who is
Oh.
the co-author of When Breath Becomes Air, is going to be our chair of the San Francisco
One of
run
our
this
chairs,
year.
yeah.
One
One
of our chairs.
yeah.
So, yeah.
I think we have 4 chairs for that, yeah. And so with that, obviously, I want to end with my thank yous. Number one, first and foremost, always to the patients and or survivors and co-survivors now, patients and caregivers in the room. You're why we do this. You are why we bring this to you every single month and why we are always willing to be on the other end of the phone. We talk about all the time about, is it good for the patient? And we truly believe, based on your feedback and the feeling we get from being able to provide this to you, that this is one of those things that is important. So thank you all for participating, particularly those of you who are in the room who come in here with all these cameras and these lights, and it can be a little intimidating, especially if you're a first-timer, for sharing your stories. It really, really is important to be able to have people be able to sign in online and participate in this. If you haven't participated remotely from here, when we are somewhere else in the country doing it, I highly recommend it. It's a completely different experience, but equally as engaging. As Michelle said earlier, they're all sort of having their own conversations online. So
I don't go to those, but I like to dial in and ask her questions.
She
It's
does.
Great.
She does when I'm at a
It's
remote.
good.
She does
Yeah.
ask questions. But I don't know if you guys know this or not, but around the country, and that's just in this country, forget worldwide, lung cancer specific support group, there's roughly 100, if not like a little less. There's really not very many. So us being able to live cast this, to be able to reach more people is really important. So thank you.
Can I say something about that?
Of
About
course.
3 years before I got diagnosed, there was an article in the newspaper, a lady that had been diagnosed with stage 4 lung cancer in San Mateo. She went looking for a support group. She couldn't find one because nobody lived long enough.
It's true.
Look at you people. So
Yeah.
congratulations.
It's very true. Thanks, Sally. Thank you for pointing that out. I want to thank our amazing staff, those who were able to stay tonight and those who aren't here. We truly couldn't do any of what we do without each and every single person working their butts off, wearing multiple hats, hour after hour, day after day. So a huge thank you to our staff, to Peninsula Television for coming in here every month. For those of you who are new, or those of you signing in who might be new, they get here around 2:30, and it takes them every bit of those 3 hours to get everything set up and running, and then they have to tear it all down and bring it back to their television station. So a huge thank you to Peninsula Television, who also will air this for the next month on Channel 26, which is local cable TV. So if
when those things that are in your head are keeping you awake at night,
You're on
dial
Channel
in at
26.
2, 3 o'clock in the morning.
You'll probably see us.
You can watch this whole
all
show.
over again. All over again. Yeah. And then the edited version of it will be available in our living room in about 3 weeks. Thank you to the Office Bar and Grill for again donating the food for tonight. Oh look, see, I get to hit this button. Okay. Oh no, I hit the wrong button.
Wrong button. There you go.
Oh boy.
There you go. Okay.
Oh no.
Hit the home button too.
Home?
Home.
Oh boy.
What's that one?
See, this is why I would never be hired as IT anywhere. Okay, thank you to the Office Bar and Grill. Like I said, thank you to Ron for bringing the dessert tonight, and Sally. Jane Millman, who I think is online tonight, she hosted a lunch today for some of our staff at her home, and she has this beautiful rose garden. So you'll see around the office all of these beautiful roses that were a gift from her. So big, big thank you to Jane Millman, and then of course all of our sponsors, whom without their support we absolutely could not bring this to you. So it's a long list, so I do have to look down and read this. AbbVie, Amgen, Astellas, AstraZeneca, BMS, Bristol Myers Squibb, Celgene, Genentech, Eli Lilly, Merck, Novartis, Takeda, Tesaro, and the Yahoo Employee Foundation. Huge, huge thank you to them for enabling us to bring this all to you. And with that, let's eat cake.